Hi, Dr. Daniels here from Steinway Family Dental Center, and we get a lot of questions about oral cancer. So today we're going to answer some of the most common questions that we got so far. The first question is, what is oral cancer? Well, the cancer is basically cells that are not normal, right? Like something changed there, and the cells not normal, whether in the way they look or in the way they behave. The next question is, what causes oral cancer? Well, the oral cancer, a lot of times it's caused by trauma, some kind of trauma that is consistent, and the cells started to adapt to that trauma and change, and they become irregular, not regular cells. Next question is, what are the early signs of oral cancer that patients should look out for? Well, of course, I would recommend that you see your dentist regularly because they are more trained for that. But what you can do yourself is to see if there's any lumps, something that is swelling up, something that is changing color. For example, something more reddish, different than the area around it, and something that doesn't heal, right? If you get something, like if you scratch yourself, it will heal like in a week or two, right? If you get a scratch, it will close. But if you have something that doesn't heal, that is not normal, right? Because normal, the tissue will heal on a person that is alive. So if something like that happened, you want to check with your dentist. The next question is, what does oral cancer look like typically in the early stages? Well, normally it can have discoloration, so there is a different color, and it also can be either firmer than the rest of the tissue around it, or softer than the rest of the tissue around it. So if it's different, it's in color or texture or feelings. Like some patients feel a little numbness if the cancer is around the nerve and it's squeezing the nerves, then the sensory functions of the nerve are not performed fully. So that could be another thing. The next question is there specific areas of the mouth that more common to have an oral cancer? I would say the tongue is pretty common, but it also could be in the soft tissue or the hard tissue of the mouth. There's different types of cancer, and they could be, most of the time it's in the soft tissue, but it does happen in the hard tissue, which you cannot just see. So you need an X-ray for that in the early stages so you can see it. Next question is, can a lump in a gum be a sign of an oral cancer? The answer is yes. This is why we check for lumps. We see and feel everything. We palpate the patient, right, which means we touch and we'll see if something it doesn't feel right. And of course it's possible, but this is why I would recommend to see your dentist for that. The next question is, how is oral cancer diagnosed during a dental visit? Well, there's different tools that we have. For example, of course, we have X-rays, right? We can visually see it, we can touch it and palpate it, and there's also a specific light that we have that we can shine on it, and it will show us if there is a difference. Then the next step would be, if we see that something is abnormal, of course you would want to confirm what it is. And the only way to know that for sure is if you get a biopsy of that. The next question is how important it is to, for a good outcomes, to get an early detection of the oral cancer. Of course it is very important because it's much easier when it's caught at a very early stage. And to remove a cancer size of a rice is much easier with less consequences than to remove it at the point where it is either inoperable already or half of the jaw has to be cut out. So it's much better if it's detected early. I hope I've been able to shine some light on this subject, although the cancer is a vast subject, and people that have been diagnosed or about to be diagnosed, or somebody who has doubts, I would recommend that you either see your dentist or give us a call here at 718-728-3314, or schedule your appointment online with us on alldentalneeds.com and request an appointment, and we can talk about your particular situation and see how we can help you.